So we're talking about patellofemoral joint pain. This is really common in runners, cyclists, and even just everyday athletes. It's really important to determine that this isn't pain at the outside or lateral aspect of the knee. This is going to be something completely different. It usually is pain at the patella, so at the kneecap. And people often experience pain behind the kneecap, at the front of the kneecap, or even just anywhere around that patella is where people usually get symptoms. Symptoms usually are felt when we're in weight bearing. So if you're walking up and down stairs is often a big one. And if you're doing any lunging, any squatting, and often even people get it when they actually kneel down on that knee and put pressure on the actual kneecap, we can get symptoms with that as well. So reasons why this actually comes about, we know that this is a multifactorial injury or condition. So often there's a couple of things that are at play. We know that biomechanics can play a role. More often than not, there is a spike in terms of training load. So if someone is doing running and they're running mostly on a level surface and they then decided to increase some hills, that this time, sometimes this can bring it about. We know that this is exactly the same with cycling. If someone's starting to add some incline cycles into their training program, this can kind of come about. Other things that can be at play, we know that strength deficits between left and right, strength deficits in terms of like hip and knee, and also control of these movements as well. And we'll always look at someone's running technique as well, because we know that it could be with something with their technique that could be loading up their knee as well. So my two exercises that I would always give for anyone that has patellofemoral joint pain are going to be, number one is going to be some foam rolling, and that's going to be really to just really settle things down and manage symptoms as best we can. So we know that our quads attach directly into our patella or our kneecap, so releasing our quads is going to be really helpful for settling that down. Okay, so what you're going to do is grab a foam roller and line down onto your front, foam roller on the ground, and what I want you to do is definitely just roll all the way the full length up and down that quad, and you're going to get into like inside, outside, and in the middle of the quad as well. Okay, next exercise that I'm going to do is going to be some toe taps. And this is a really good exercise for developing some strength, control, and stability on single leg, and also isolating a really good glute strength. Okay, so what you're going to do is loop bands around your knees. We're going to come into a hinge position, so hinging at our hips, weight comes across to one side, lifting this leg, and you're tapping out to the side. Okay, and really important that we're not putting any weight through this leg. All our weight is on this single leg. And another thing to watch is we don't want to let this, when we're tapping, we don't want this knee to drop in. We want to keep this pushed out against that band. So if we have a look at this from the other side, again, we're adopting that really hinged position. Weight comes across and we're tapping out to the side. With these, you're going to do 3 sets of 10 each side. So there are my 2 exercises. Give them a try.